Have you ever wondered exactly where the SI joint is and what the SI joint means? Well, let's find out. So here's our little skeleton friend. We're going to blow him up a little bit. And this is the eye of the SI joint, also known as the ilium, which is the hip bone. And you can see that it's three-dimensional, it's pretty big. And then it has to articulate here with the sacrum, which is the S of the SI. The sacrum is just a bunch of fused vertebrae at the bottom of your spine. The reason you have a tailbone is that's the very tippy end of the sacrum, and the sacrum has to rub up next to the hip bone. So they have this weird flat joint that runs along the inside of the hip. So sometimes you get soreness along the joint line. That's where that soreness that you can feel, that you can push just below. Like most people, when they show me that their SI joint is, they'll push like right here on this spot. Another potential sore hip area would be, once we layer on some muscles here, and you can see all the muscles that hang on to the sacrum. So there's a bunch of them. There's a lot of S muscles, and then here comes the I muscle. So here's an I muscle, the hip muscle. This muscle is the piriformis. Its job is external rotation of the femur. So it is, I like to call it the pinky, and the other external rotator of the hip, of the femur, is this guy, the glute. So I'd rather a big, gigantic, powerful muscle would work to roll out my femur instead of relying on a teensy-weensy little piriformis. But you can see how there's sort of, the piriformis is kind of at the base of that SI joint. And so sometimes people think they have a tight piriformis, and sometimes it's truly the joint that is the problem. So welcome to the wide world of SI joint pain. In either case, you want to make sure that you do not have teeter-totter hips, and you want to have both hips in the same horizontal planes. You want them level with each other. And I usually find that the I muscles are the ones that aren't working quite as well. The S muscles are plenty strong, so the back muscles are plenty strong. If we layer on some more back muscles here, there are some monster big muscles back there. Big muscles back there. And then you can see the direction of the glute fibers here. They run diagonally. So in order to get them to contract, you have to move in this direction, which means sideways. So if you're not doing any sports or any activities that allow you to move sideways, it's very difficult to get these muscles to work. If you're a big walker, sometimes what will kick in instead is this muscle, and this is the next glute muscle down, which is the glute medius. And if we unpeel the layer, you can see that it attaches here. And sometimes people will tell me they have a screwdriver sort of feeling right here, like a screwdriver is just going right where the muscle attaches here in the back of their hip. That's just, this muscle is in charge of internal rotation. Its best friends are all the muscles on the inside of the thigh. That's very fixable. So what we have to do is just get you some more glute in either case. Okay, welcome to the SI joint.